Hi, I'm Del Schutte, the director of the Joint Replacement Program at East Cooper Hospital. We have a program that has a number of things that we think provide a more excellent experience for people with significant joint pain. We have very high patient satisfaction. Number one in the Tenet system for the last 14 years. We work very hard on quality issues. Our goal is to provide a very personalized, high-tech, high-performance joint replacement and joint care program for patients who are suffering from arthritis or other types of hip, knee, shoulder pain, particularly, that is limiting their lifestyle. The one thing that we urge everybody to do is to get an opinion as soon as possible and find out what's causing your pain so that we can maybe offer something less invasive or less costly that may give you equal relief before things get too far down the road. One thing we see is that people sometimes tend to tough it out and they have pain for a long time. They've limped along and the muscle's gotten weaker. We can fix the problem that caused the pain, but then the muscle's weak and that's a much harder recovery. So we would encourage you to check it out, find out what makes us different, what makes our program special, and what makes East Cooper Joint Replacement Program the destination of choice for your joint care. Hip replacement is one of the most commonly successful and most successful hip surgical procedures available in the United States. Currently, almost 500,000 hip replacements are done each year, along with over 500,000 knee replacements. The total volume is about 1 million joint replacements a year. The good news is that not everybody that has hip pain needs a joint replacement, but if you do, it is a very efficient procedure, takes about 45 minutes, and we feel should last up to 40 plus years with almost unlimited activity. There are special implants that allow patients who are water skiers, snow skiers, wakeboarders, high performance activities that allow them to get back to those full activities. The main thing that we like to do is make sure that when you come in with hip pain that's limiting your lifestyle, keeping you awake at night, or keeping you from enjoying your activities of daily living, your sports, your family, your grandkids, we like to make sure that when you're having pain in a certain area, that's the area where your pain is coming from. It's not uncommon to see people who feel pain in a certain part of their hip, and the pain can be originating from the back or from the knee. So we urge you to get it checked out as soon as you can so that we can find out the actual source and cause and then manage it appropriately. Now, hip pain comes in a variety of different sources. It can be, as we mentioned, a nerve pain, it can be a bursitis, it can be a tendonitis or inflammation of the muscle, or it can actually be an inflammation of the joint. The younger people sometimes get what are called labral tears or tears of the cartilage of the inside of the joint that don't necessarily require a hip replacement. And we're in a position to offer physical therapy, injections, non-replacement type procedures that actually relieve the pain and, again, get you back to your activities. One of the problems that we see frequently are people that live with the pain because they don't want to be a bother, they don't want to complain, and so they live with the pain, they favor that leg, they limp along, and the muscle atrophies or shrinks, and when you get the source of the pain fixed, it's very hard to rebuild the muscle. We like to compare it a little bit to a car. If you think of the joint as the tire and the wheel, the muscle is the motor. So you can have the best tire and the best wheel, but if the motor's not strong enough, it's not going to do you so much good. So it's very important to keep your muscle strength as strong as you can so that whatever's done to the joint itself can function well. There are a number of things that we do prior to caring for somebody if we decide that they're a candidate for example, a joint replacement. One of the determinants of having an excellent joint replacement or an excellent result is making sure that you're properly prepared before. We have a very extensive preoperative program for both the hip and knee replacement procedures that requires that you have a full understanding of what you're going to be getting, that you visit the hospital, you understand the therapy, the ward, the different procedure, the way you'll check in, the medicines that you'll be given. And we also try to make sure that you're in optimal shape before you get the procedure. Some people think, well, I'll just get this procedure and my life will be changed, but it's a little bit like running a marathon. The more prepared you are before, the better your result will be. So we make sure that things are okay with your heart, your lungs, your overall medical condition, any diabetic considerations, skin issues. We like to make that sure that that is as optimal as possible so that we can give you the best possible result. We like to call it surgery for a lifetime. Ideally, you would have one surgery that lasts you the rest of your life and allows you to be active and pain-free. The main thing is don't be afraid to ask. Sometimes it can be something very simple, and we have a lot of experience. It can be a simple question for us that would keep you up several nights. We're available 5 days a week. We have a very extensive staff with physicians and physician extenders ready to answer your questions and keep you active. So you don't have to wait until you feel like you need a joint replaced or a shot or an arthroscopy before you just ask the question and find out what it is that's causing the pain and limiting you. And a lot of times it's a very quick and easy answer that will get you back to activity. And maybe even help prevent a more extensive procedure like a joint replacement. If you find that you're having joint pain, hip or knee or shoulder pain, or any bone and joint issue that's limiting your lifestyle, please call, don't hesitate. We're available. We can help find answers sometimes that are much simpler, much less costly, and much more effective than you might otherwise find. And sometimes we can help you prevent a more aggressive care or procedure later on if you get it checked out early. Remember, East Cooper and the Charleston Joint Replacement Institute, your choice for high quality, high tech, high performance joint care. Thank you.